What can provide relief for a bulging disc in your neck? The spine consists of vertebrae stacked upon another, and in between every set of vertebra or bones, there's a disc in between, and these bones are separated by the discs up through your entire spine. And the disc consists of two main parts: a tough outer layer known as your annulus and a soft inner part called your nucleus. A bulging disc occurs when the disc inner nucleus is pushing towards the outer annulus, causing it to bulge outwards. Think of like an ice cream sandwich, right? And you have two bones or two cookies, and as you shift the cookies, the ice cream will bulge out on one side. And so therefore, when that pushing occurs, the bulging disc can take up space within the spine, potentially compressing nerves and other spinal tissues, and this can lead to other problems. Now, disc health is a key component of spinal health, and there's many different ways that can affect that can cause discs to bulge. And I think the most common one is something that I mentioned, is with alignment. Now, discs are very important because they provide cushioning between adjacent vertebrae, they prevent friction and degeneration. Discs also provide the spine with structure. These adjacent vertebral bodies attach to the disc, so the shape of the disc ultimately helps determine the shape of the spine. This also combines the forces to make the spine more flexible. Their soft gel-like interior allows for significant motion, and they also act like a shock absorber, allowing the spine to distribute forces evenly to deal with mechanical stresses like compressive stresses as a result of gravity. Now, bulging discs can really occur anywhere in the spine, but it's definitely more common in the lower spine or the lumbar spine, but it can also occur in the neck, because normally alignments or misalignments can occur anywhere. Now, the symptoms associated with bulging discs are not always universal, meaning that you can have bulging discs and have no symptoms at all. In fact, it's estimated that asymptomatic patients that are just walking around, there's a significant portion of the population that have bulging discs and don't even know. However, if the bulging disc starts becoming symptomatic, it can start causing pain in the neck, the shoulders, the chest. It can radiate into the arms. It can radiate into the upper traps. It can cause numbness and tingling into the hands. And it can also cause weakness into the hands. It can cause decreased range of motion in your neck. And it can cause increased pain levels during movement, especially one way versus another. Now, the best way to provide relief for a bulging disc is to determine what's causing it. Now, the most common cause associated with bulging disc is something to do with alignment, like I mentioned. We have alignment issues. The spine is not aligned properly. It will cause the disc to bulge in one direction versus the other. So anything that's done to help restore normal cervical alignment will help improve the bulging discs that are associated with it. Now, common non-surgical treatments can involve things like physical therapy, chiropractic care. It can be hot and cold therapy, even lifestyle modifications. And when pain becomes significant, normally they can provide medications to help numb the pain. But the best way to deal with it is to improve the alignment that's associated with the bulging disc. Other things that can cause bulging discs that are maybe not associated directly with alignment could be degeneration. Now, degeneration, as the spine starts to deteriorate, it can cause asymmetrical pressure throughout the entire spine, and it can lead to some disc bulging. But the best way to preserve disc health is to practice a spine-friendly lifestyle. This is really staying active, making sure that your spine is healthy and well, maintaining healthy weight, maintaining good posture, maybe even having your spine evaluated regularly for alignment issues, lifting heavy objects correctly. Maintaining disc hydration and health is a key component in spinal activity. So the more immobile you become, the more the spine may become less aligned, and the less alignment typically leads to disc issues, which can lead to bulging issues. So maintaining a spine healthy lifestyle is something that we recommend for patients that potentially could be at risk for bulging discs. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.